and immediately after running, they will lie down on the couch and we will rescan the heart. Now we're going to go to the next stage where I'm going to show some of the equipments that we use in order for us to actually detect if someone has got any evidence of coronary artery disease or blockage in the coronary arteries. First of all, there will be this machine. I'm sure most of us have seen this machine. This is what we call as ECG, echocardiogram. So what it does is actually sets of leads. There's about 12 leads put on the chest, the hands and the legs. So normally if someone walks to any hospital or to see any doctor, the first thing they would ask to do is an ECG. And we're going to measure the rhythm, which is the heart activity, on a piece of paper. These are the examples of the tracing that we can get from a particular patient, whether there's any evidence of blockage or any evidence of previous heart disease, which we can capture from this ECG. The next equipment is the echocardiogram, which is a form of ultrasound which detects the heart functions, the activity, and also any other structural abnormalities that we can find in someone's heart. So these are some of the examples or the pictures that we can get. Third thing I want to show you all is basically what we call as a stress test. Now, few tips and tricks that they need to know or someone need to know before they do a stress test. Well, obviously, when they walk on a treadmill, we would like them to wear the proper attire. For example, if they can wear something like a tracksuit or loose clothes, as well as wearing sport shoes. And of course, in our place, we do provide that in case if they're not wearing any shoes. And of course, try to do the test when they are not that full in their stomach, they're not just eaten, for example, because this could just slows down their activity in terms of doing the stress test. Sometimes we do advise to avoid certain medication before running on the stress test. For example, things like beta blocker, calcium channel blocker, which can slow down the heart rate. So maybe some advice may be needed before they go for the stress test or the stress echo. Basically, this treadmill test is something that we get the patient to walk or run for a certain period of time. Normally, they come in stages, stage 1, 2, 3, and maybe stage 4, until they reach their certain target heart rate. And then we're happy with the results, and then we'll stop, and then we'll get the patient to lie down. Meanwhile, when they are doing the test, this machine will actually go on their own pace, and at the same time we will also connect them to the ECG, and this ECG will be shown on our ECG screen. At the same time, if we opted or the patient opted to do additional tests, what we call as a stress echocardiogram, so we will add the procedure whereby we will scan the heart like what I showed earlier before they run, connect to their ECG, and then they do the running, and immediately after running they will lie down on the couch and we will rescan the heart and we will compare the structure of the heart before and after running. From this kind of test, we can tell or we can detect whether there's any problem in terms of the circulation, in terms of the activity of the heart when, before and after they run on the couch. The next device that I'm going to show you all is a device called Holter, which is ECG monitoring, which can last for 48 hours. So this machine will be actually connected via these leads and will be connected to the heart, and this one we can carry in the pocket, and then it will just continuously record the ECG. This we will use mainly for patients who complain of dizziness, palpitations, feeling aware of their heartbeat, whether it's too fast or too slow. And in our hospital we have 3 different types of these tests, and two of the tests can actually be brought over. It can be used during taking showers, but unfortunately this one we can't allow the patient to have any contact with water. Now we are in our last test that I'm going to show. This is what we call as the CT coronary angiogram. So the machine that we have is in our hospital is Siemens 128 slices CT coronary angiogram. Basically, before we proceed, we will have to get the heart rate roughly less than 65 beats per minute. If, for example, the heart rate is faster than 65, normally we would give some medications to actually try and slow down the heart rate. Once we have achieved the heart rate of less than 65, we will also make sure that they have a big sort of line or ventilon into the right hand or the left hand. So when we proceed with the test, during the procedure, we will warn the patient that they're going to feel something hot inside the body. And once they are ready and the heart rate is slow, we will then inject the special medicine or contrast, which will then travel along to the heart and the CT images can be taken. That I also want to mention is that the CT scan cannot be done if somebody has got some form of kidney disease. So before this test can be done, we need to check their kidney function by blood test. Now I'm going to show some of the results of the A patient with the CT scan. Now you can see on the screen there's 4 different compartments, and basically this is actually an example of the artery. So we were talking about any blockages that we can see. So there are actually mainly 3 main branches. This is the left side, this is the left side to the front, left side to the back, and now this is the right side which goes right to the back. Okay, if we go to the next screen, this is an example of the 3 main arteries or the 3 vessels which has been shown on each different segments. Now you can see this is an example of a blockage. Okay, you can see this is narrowing here as opposed to the one top here and the bottom here. So there is actually definitely some kind of narrowing there, and there's also another narrowing on the right side artery, which is this here. So this is roughly about 40-50%, and this is roughly about 50-60% blockage, and there's only one artery which looks quite normal. So now in summary, we have seen all different type of tests. Now obviously people with chest pain, and also they have quite a significant risk factors. For example, they have diabetes, hypertension, high cholesterol, smoker, family history. So these people, I would really suggest to go for a best test. We call it this CT coronary angiogram, because the pickup rate is almost 95 to 100%, as opposed to the other tests that I've mentioned earlier on. It's roughly between 80-85% accuracy or sensitivity. Now, once we detected the problem and we find, for example, like what we saw in this picture here, we may then suggest the patient to go for a proper coronary angiogram, which means that we really have to do an invasive procedure. We have to put some tubes, wires, balloons, and perhaps stents if there is significant blockage in the arteries. That's all from me. Thank you very much.